I was in getting some other work done. Obviously they noticed that I was missing 2 teeth and suggested that I come in and get a consultation to get some work done. And I was kind of apprehensive. I'm like, geez, I've gone this long, I've learned to smile without really, showing my back teeth, or, I've learned to laugh without opening my mouth too wide so people see that I'm, short a few teeth. But they, not persuasive, but said, hey, it's worth a look. Dr. T is going to be doing some training on a large implant dentistry, and he really thinks that you're a great candidate and would like to see, if you'd be interested. Came in and we talked about it, and I was apprehensive, like I said. I mean, it's, they're drilling into your jawbone. Who wouldn't be worried? But when they explained the process, that was very secondary. It wasn't that, we're gonna get in there with a drill and we're gonna do this and do that. It was, these are the benefits. These are the things that you're gonna see from getting that work done. Your bite's gonna stay more consistent. You're gonna see little, some pressure that's not there. Teeth are gonna form better. And so they didn't sell me on it, but I mean, it was explained to me very well to where it seemed like a natural thing to do. So when I came in for the process, they offered me a twilight pill to ease the pain, and I said, I really want to be around for this. I want to know what's going on. So they numbed me up, and we went right at it. And I was apprehensive or nervous coming in, thinking, geez, what kind of pain is this going to be? Am I going to be able to go to work tomorrow? Am I going to be, able to, run around with the kids tonight? And, what's going to happen? And they explained all that to me as we were going into the process, that, tonight you're going to be a little bit sore from having your mouth open. Tomorrow, your jaw is going to feel a lot of pressure. You may not want to work, but more than likely, you can go to work. I mean, they laid it out. There were no surprises in how I was going to feel, and gave me some antibiotics, and got me all set up with that. But the actual process was, it was painless. I mean, they numbed up, and you always worry about if they numb the right places, and Dr. T, gives a nice wait time. He doesn't rush through the process to make sure that everything is correct and you're ready to go. And doing the process, they kind of let you know where they're at, what they're doing. There's nothing left to your imagination as they're doing it. So, and I think they did 2 of the implant bases, I think is what, I don't know what they call them, but they drilled in twice into my jaw, and they put those in, and I was in and out of here in less than, I think, 2 hours. And cleaned up. I mean, I could have went right back to work. You could not tell that I had the work done. It was numb, and that was it. And I was just fine that night. A little bit of pain, a little bit of pressure. Got up the next morning, and I went to work, just like they said. Pain pills were not needed. Some ibuprofen did the job. So basically everything they told me was gonna happen did, and the things that they said weren't gonna happen didn't.